Hi, welcome to this month's episode of Tea with Lisa. It's April, and so this month we are going to be talking about mental health resources in the CSRA for both adults and youth. I want to go ahead and say, sorry I missed all of you last month. I was out sick, but Rochella filled in for me, and she did an awesome job. And so thank you to Rochella, and thank you to Jordan for having to do it all by himself behind the camera last month. So my guest today is going to be Rosemary Atkins, and she is the Apex Coordinator Counselor for Serenity Behavioral Health Services. So, Rosemary, I guess I will let you introduce yourself and briefly tell us about Serenity Behavioral Health.
Okay, great. Hi, I'm Rosemary Atkins. I'm a mental health counselor, and I work in the Child and Adolescence Department at Serenity Behavioral Health. I'm also the Apex Coordinator and the LIPT Chair for Wilkes County and McDuffie County. Serenity Behavioral Health is a community service board. We serve East Central Georgia, and we provide comprehensive behavioral health and developmental disability services for children, adolescents, and adults.
Okay.
Talk a little bit about some of the APEX program. I said I was the APEX coordinator. The APEX program is an in-school program that is funded by the DVHDD. We go into schools and we counsel kids and families in school.
Okay.
We are currently have 4 schools in Richmond County. We are in McDuffie County at all the schools.
Okay.
We're in Wilkes County at all the schools in Wilkes County and Lincoln County as well.
Okay. And is it certain grade levels or any grade level?
We do all grade levels. I have primary school up until high school, so we do pre-K all the way up to graduation and some post-graduation as needed.
And is it? I guess they get referred to you by a school counselor. Is that how that works?
We do partner with school counselors. We also partner with medical professionals in the community, and they give referrals to us. And then we do the intake assessments, and then we start seeing the kids in schools.
Okay, great. Sounds like a good program. What does APEX stand for? Something in particular, or? I know we all have acronyms.
We all have acronyms. Yes.
I was just curious.
Yeah. I think it does, but I'm not going to lie to you. I'm not sure on that acronym.
Well, we all just know the acronyms, right?
Yeah, exactly.
Well, what types of mental health services does Serenity provide?
Okay, we have a lot of key services. We have the adult behavioral health, which is the outpatient services. We provide individual and group therapy. We do psychiatric evaluations, medication management for conditions such as depression, anxiety, bipolar. We also work with trauma and other serious medical illnesses. We also have within the adult services, we have substance use disorder services. We do outpatient addiction treatment, medication assisted, which is the MAT services for those who have opioid dependencies. We do relapse prevention, co-occurring mental health disorders, as well as we do harm reduction and prevention of overdoses. We do a lot of programs and education and events and services to prevent fentanyl overdoses.
Okay, and I know that's kind of a big thing right now.
That
the fentanyl
it definitely is a big thing right now. And we're going to talk a little bit later about an event that we're having very soon coming up.
Good. So, and do y'all do you have is it a crisis stabilization unit?
Yes, that was my next one. We have a crisis stabilization unit, and at Serenity, we're super excited about a new building that we received a grant for that is about to open. We're about to have a ribbon cutting. I don't know the exact date yet, but it's a beautiful facility that's going to provide more beds and more services for those who need crisis services. It provides short-term psychiatric stabilization. We do some detoxification, safety monitoring for individuals, make sure that they're stable before we release them back out to their environment, or if needed, we will refer them out to more services, more long-term services.
So Rosemary, I know you mentioned the APEX, and you also mentioned the Crisis Stabilization Unit. Can you tell us some more about some other services that Serenity offers?
Absolutely. We have what's called IDD services, which is our developmental disability services. Those are support services for individuals with intellectual and developmental disabilities, which includes skill building and community integration supports. And then we have our community support services, and the alphabet soup for that is CSS and CST. That's our case managing and housing assistance program. We offer case management, housing assistance, employment supports, and psychosocial rehabilitations for individuals with serious and persistent mental illness.
Would that be considered stuff like depression, anxiety,
And that does, any kind of mental health disorder. It can be anything bipolar. It can be schizophrenia. Anything with that serious, persistent mental health illness. Also homelessness and things of that nature. They work to get housing assistance and also help them get back on their feet with any resources possible. And we definitely have a whole book full of resources. If we can't provide it, then we will help them with other resources.
Kind of similar to how we do here.
Exactly.
We can do.
Exactly.
We try to hook them up with our community partners. So.
Exactly.
Okay, well, I know we talked about APEX, so can you tell us a little bit more about the youth services in addition to the APEX program?
Absolutely. I am a counselor for the CNA department, which is child and adolescence, and we serve children from birth up until graduation, which can be up to 21 years of age. Yes. Basically, we have early intervention for 0 to 5. We have a program called CPP, which is child-parent psychotherapy, which is a dyadic therapy where the child and the parent work through trauma with the child and trauma with the parent and build the relationship with the parent and the child. We do a lot of that through play therapy. There's a lot of assessments that go on with that before we get to the play therapy, but it's helping the parent and the child interact to better build their relationship and have that early intervention to hopefully prevent later issues in the child's life. We also have individual counseling, psychiatric care, medication management, and we do care coordination for youth. And we often collaborate with schools and other community referral sources. We are, again, a part of the APEX. We talked about that in the beginning. I'm the APEX coordinator, and I'm also a LIPP chair, and we are LIPT in several counties in the area, and that's the local interagency planning team, and it's a collaborative group that is established to help children with severe mental health issues and to coordinate services for children and youth. That program implements a team of people from DJJ, the CSB, which is the mental health part, the Department of Health, the schools in the area, and several other.
So it's a collaborative.
It's definitely a
team effort.
Yes, it's definitely a team effort, and we do that within several communities. We also have we have 6, 7, 8 counselors. We have also a community service individual who goes out to the schools, and we have a peer professional who also works with the parents of our children. So we do have a lot of wonderful services in the
so peer support is part of the
peer support is also
the services there.
Yes, yes, ma'am.
And then is there peer support for youth and adolescent, or is it just parent peer support?
We do peer support for parents as of right now. We are looking to get the funding to do peer support for the adolescents because that's the kind of a grant that we're looking to get. So that hopefully will be coming soon as well. To get into the CNA program, you do call and make an appointment, and the number is 706-432-7825. You can call there and make an appointment for an intake. And what we'll do is we'll do a biopsychosocial, which is going to be an intensive intake process. It takes about an hour and a half. And we're going to ask all kinds of questions. So we can get to know not only the child, but the parent as well.
Okay.
And then we bring you into services. We do individual services. We do family services. Anything that the child will need, we put that on our treatment plan and get them taken care of.
Okay. Is there a charge for that, like for the children's?
We mostly work with kids who have Medicaid.
Okay.
Medicaid and the Medicaid CMOs. We do have a counselor now that can do some private insurance.
Okay.
But private insurance can be a little tricky because they don't pay for long term on most cases. But we are finding that they are getting better at helping our kids and our youth.
Okay. Okay. Well, let me ask you this. So if someone is looking for mental health services that aren't at a crisis level, what is the process for getting help? What would that look like?
Okay. Well, on our adult side, we have open access intake, and that's going to be during the hours Monday through Friday. It starts at 7:30 a.m. From 7:30 to 11 a.m. You come in on a first come, first served basis.
Okay.
They do the intake, and after that, they get enrolled into the services that they need, and appointments will be made.
So you mentioned the mobile units. Can you tell us a little bit more about that? I'm not familiar with that at all.
Absolutely, yeah. That's something new to Serenity. We now have 2 mobile units who go out to the rural counties. They will do initial intakes on clients who cannot get to Serenity. And they'll also do medication management. We do have a calendar of the dates and places that they will be at serenitybhs.com.
Okay, and so that's a new initiative you said. So
that is a new initiative that we're...
all of the rural counties or just certain ones right now?
Right now, I know for sure that we're in McDuffie County and Wilkes County, and I'm not exactly sure where else they go.
Okay. All right, that's a good service though, because a lot of times rural areas kind of get left out of a lot of services.
Yeah, with me being in Wilkes County as often as I am, I get asked a lot about adult mental health services, and before I had to tell them they have to go to Augusta, and now it's just easier for them to either go in Wilkes County or head to McDuffie County to get these services.
Okay, great. Did you have something else you wanted to?
Yeah, and another organization, we also work with housing and social service providers that support transitions from homelessness to stability via coordinated care and voucher programs.
Okay, very good. Well, lots of good stuff going on there. Serenity.
and we're growing all the time, so it's.
And that is good. And y'all are out in South Augusta, right?
We're out in South Augusta, 3421 Mike Pageant Highway, right off of Bobby Jones Expressway.
Okay, yeah, I knew you were out there.
Yeah,
out there.
You can't miss us now because our brand new CSU has been built there, and it's absolutely beautiful.
Awesome! I can't wait. I'd like to come out there and check that out. So, do you have any upcoming events you would like to share?
We do. We have one that we do every year. For the past 5 years, we're going to have our 5th annual fentanyl awareness event on our campus from 10 a.m. to 2 p.m. April 29th. We invite the community members and stakeholders to join us in raising awareness about the deadly epidemic that continues to impact our communities.
Fentanyl is a big one.
Fentanyl is a big one.
Is that the number? Yeah. The number one.
Right now, that has been a big issue. We're having a lot of fentanyl overdoses and deaths in our community and in America.
Yeah.
So that's something that we're really trying to make aware. We collaborate with advocacy organizations, including promotion of the National Alliance of Mental Illness, community resources and peer support initiatives. Of course, we do community partner engagement, including hosting tours and coordinating meetings.
So I've heard that y'all coordinate with the Boys and Girls Club of Augusta. Can you share a little bit about that with us?
Yes, we do partner with the Boys and Girls Club of Augusta. Right now, we do groups and individual sessions at the Boys and Girls Club, the downtown division,
Okay.
and we provide services, mental health services, and we talk about many different topics there on our weeks when we go and do the groups. We've also worked with the other locations of the Boys and Girls Club, but right now we're working mainly with the one downtown by
Okay.
the Rec Center.
And is it couple days, couple times a month, or is it
Yeah,
certain?
we do it on the first and fourth Tuesday of every
Okay.
month.
Okay. And are they any of the children that are in that program, Boys and Girls Club,
Yep.
can participate, or how?
Right now we're working with teens.
Okay.
Our main concept is the teens. To do that early intervention
Yeah.
because of the teen violence and
Yeah.
the challenges that teens face these
Yeah.
days. So we're really focusing on our teenagers right now.
Okay. All right. Sounds good. Well, Rosemary, I want to thank you for being a guest today here on Tea with Lisa. You shared a lot of good information with us. I know mental health is something that everyone in the community can relate to personally, or maybe family member or friends or whatever. So it's a lot of good information about Serenity that our viewers might not have known about. So how can they reach y'all at Serenity if they want to reach out, to, ask questions, or find out about services?
Great. Our website is serenitybhs.com. Our main line for Serenity is 706-432-4800. And to reach the Children and Adolescents Department, it's 706-432-7825.
Okay, great. Well, thank you again for being here. Appreciate
Thank you.
it. It was good and very informative.
It's absolutely my pleasure. Thank you so much, Lisa.
Well, thank y'all for watching this month's episode of Tea with Lisa. Just want to remind you, if you have any questions for us here at Walton Options, you can call us here at 706-724-6262, and we'll be happy to answer any questions we can for you. Remember to follow us on all of our social medias. We're on Facebook, LinkedIn, Instagram, and YouTube. So all of the past episodes of Tea with Lisa are also on our website at waltonoptions.org. So check that out, and we will look forward to seeing you next month. Bye. Oh, she wants you to wave too. I forgot to tell you to wave when I'm done. I forgot to tell you about the waving part.